Hey, Future RN! Today we're doing an analytic deep dive into the stages of shock, from that initial cellular response all the way to the irreversible point. You know, this is one of the most tested concepts on the NCLEX because it really shows how the body tries to survive and when it fails. Welcome to ClearPath NCLEX. Let's break it down step by step so you really truly understand the why behind each stage.
Okay, so let's just start with the basics. What is shock, really? At its absolute core, it's a failure of circulation right down at the cellular level. I want you to think of it as a major crisis of tissue perfusion. When your cells don't get the blood flow they need, they are literally starved of oxygen and nutrients. And that right there is what kicks off a super dangerous cascade that can lead to multi-organ failure if we don't stop it.
And this right here, this is the fundamental starting point for everything that follows. Without oxygen, our cells are forced to switch gears. They go from their normal, really efficient aerobic metabolism to this kind of desperate, inefficient anaerobic metabolism. And the toxic byproduct of that process is lactic acid. As that lactic acid builds up in the blood, it causes a state of metabolic acidosis. And that is the first major domino to fall.
So here's our roadmap for this explainer. We're going to walk through this whole thing like a physiological story. We'll start with that silent beginning. Then we'll watch the body fight back. We'll see exactly where it begins to fail, and then understand that point of no return. And of course, we'll wrap it all up at the essential NCLEX priorities.
All right, let's analyze what happens in this initial stage. This is the very first moment that the crisis begins. It's subtle, it's all happening at the cellular level, and this is the critical part. It often has no obvious outward clinical signs. You know, at this stage, the patient might look completely fine. Their vitals could even be stable, but deep down, under the surface, that critical switch to anaerobic metabolism has already happened, and lactic acid is just starting to creep up. Now, the most important thing to remember here is that the damage is completely reversible if we can just identify the cause and restore perfusion, and do it quickly. Okay, let's move on to stage 2 and see how this thing builds. Now, the body's alarm bells are just ringing off the hook. It has detected that drop in tissue perfusion, and it launches this massive, coordinated defense to protect its most vital organs. We're talking about the heart and the brain.
So these are the classic signs you're going to see on the NCLEX. The patient's heart is racing, they're breathing fast, their skin gets cool and clammy, and they might seem a little anxious or restless. Now, notice this. Their blood pressure might still be normal, but the real question, the critical thinking question, is why? Why are all these things happening?
And this slide right here brilliantly illustrates the why. First, the sympathetic nervous system kicks into high gear. That's your classic fight or flight. This is what causes the tachycardia and the vasoconstriction. That vasoconstriction shuns blood away from the skin, which makes it cool and clammy, and sends it towards the core. Then, the kidneys activate the RAS system to hold on to salt and water, trying to boost blood volume. And finally, the lungs try to help out by breathing faster. That's your tachypnea, to blow off acidic CO2 and try to correct that metabolic acidosis.
So, what you really need to remember about stage 2 is that all those signs and symptoms you're seeing, that's the body's compensation mechanisms in action. It is fighting so hard, and its main goal is just to keep the heart and brain alive. The good news is this stage is still reversible, but it's going to require aggressive and immediate treatment. That window of opportunity is definitely closing.
Now, watch how that compensation starts to break down. In the progressive stage, despite all the body's best efforts, the underlying problem is just too overwhelming. All those defensive measures are starting to fail, and the patient's condition begins to rapidly deteriorate. And this is where the clinical picture becomes truly alarming. The blood pressure, which the body fought so hard to keep up, now plummets. Because the brain isn't getting enough oxygen, you start to see that altered mental status, the confusion and the lethargy. The kidneys are failing, so urine output drops to almost nothing. The skin starts to look mottled. This patient is now visibly, critically ill. So why does it all just fall apart? Well, the defining feature of the progressive stage is a massive increase in capillary permeability. That prolonged lack of oxygen actually damages the tiny blood vessels, and it makes them leaky. Fluid just pours out of the vascular space and into the tissues, causing widespread edema, which only worsens the perfusion problem and causes that blood pressure to just crash. And this is the absolute key takeaway. Stage 3 is the beginning of multiple organ dysfunction syndrome, or MODS. Every single organ system is now at risk. Reversing shock at this point is incredibly difficult, and honestly, the patient's prognosis is becoming pretty grim. This brings us to the final and most tragic stage, irreversible shock.
also known as refractory shock. I mean, the name really says it all. The damage is now so widespread and so severe that the body simply cannot recover, no matter what treatments we give.
In this stage, the blood pressure is profoundly low, and it just doesn't respond to medications or fluids anymore. The patient is comatose, there's no urine output, and the acidosis is severe. The body's systems begin to shut down completely, and that leads to total cardiorespiratory collapse. And the physiological reason for this is that cellular death has become systemic. The energy stores that are needed to run all that cellular machinery are just completely gone. The heart, the brain, the kidneys, all the vital organs have failed. At this point, sadly, death is inevitable. Okay, so let's pivot from all the pathophysiology to what you, the future nurse, need to do. This is all about getting into that NCLEX mindset of prioritization and action. This single most important factor in a patient's survival is early recognition, especially way back in stage 1 or 2 when things are still reversible. So, when your gut tells you something is wrong and you suspect shock, what is your absolute first priority? It's always going to be your ABCs: airway, breathing, circulation. Next, you want to apply high-flow oxygen to maximize the oxygen content in the blood that is still circulating. Then, secure large-bore IV access for rapid fluid resuscitation to help increase that vascular volume. After those initial actions, your job is to monitor relentlessly, watching those vitals, urine output, and mental status for any changes, while you work with the team to find and treat the root cause. This slide right here is your ultimate study tool for the stages of shock. I seriously recommend taking a screenshot. It lays out the entire progression side by side. I want you to notice how blood pressure is one of the last vital signs to drop. That's a critical point for the NCLEX. You can clearly track the progression from just restless to full-on coma, and you can see exactly when that window for reversibility slams shut.
So please, remember this. Don't just memorize these lists of symptoms. You have to understand the pathophysiology, the why behind the tachycardia, the cool skin, the dropping urine output. This deep level of analytical thinking is exactly what the NCLEX is designed to test. When you understand the story the body is telling you, you're going to absolutely crush these questions.
I want to leave you with one final thought to really reflect on. We know that in that compensatory stage, vital signs like blood pressure can look deceptively normal. So what single lab value is your most reliable, most objective indicator that tissue perfusion is failing and the patient is getting worse, even when their BP looks okay? Think about that. If this deep dive helped you connect the dots on the stages of shock, please give it a like and subscribe to ClearPath NCLEX. We're here to give you more of the clear, in-depth analysis you need to walk into that exam with total confidence. You've got this.